A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. There was a time when flu season drew near, and then some of us would just take a flu shot, and if we could, we'd hope for the best. But times have changed. Now we have to be aware not just of the flu, which could prove catastrophic for some people if it morphs into pneumonia, but also COVID and respiratory syncytial virus, or RSV, which is highly contagious, impacting babies and older people. Now, despite having vaccines available, particularly for COVID, according to the CDC, about 7% of adults and 2% of children have gotten the new COVID shot. And as of October 2023, just 29% of adults have gotten an influenza vaccine. Now, we're fortunate to have the tools to fight these serious illnesses. But why are some people not choosing to do this and protect themselves and others? We'll pose these questions and more to one of Western New York's leading medical experts on this edition of your Hometown Health Connection. We welcome back Dr. Thomas Russo. He is a SUNY Distinguished Professor and Chief of Infectious Disease in the Department of Medicine at the Jacobs School of Medicine and Biomedical Sciences. A renowned infectious disease expert, Dr. Russo cares for hospitalized patients at the Buffalo VA Medical Center. He's the recipient of numerous awards and is often quoted in national publications. He has an active nationally funded translational research program studying antibiotic resistance to bacteria and potential new bacteria targets to develop a new class of antibiotics. He has been a local and national resource to educate and inform healthcare providers, the public, and businesses on how to best manage the COVID-19 pandemic, which is where we first met Dr. Russo a little while ago. Dr. Russo, welcome back to your Hometown Health Connection.
Thank you for having me on.
So Dr. Russo, tell us what RSV is, who is at risk, and what age groups are at risk for getting the most serious case of RSV?
RSV is one of our three major respiratory viruses. The others, of course, you'll be familiar with: influenza and SARS-CoV-2, which is the cause of COVID. Now, RSV is a potentially lethal virus. In fact, in children under the age of 5, in a bad season, we may have as many as 300 deaths. And surprisingly, in older adults, in a bad season, we may have as many as 10,000 deaths. Now, not all groups are at equal risk for developing severe disease. In fact, most children will develop RSV infection by the age of 2. But those children that are at greatest risk for developing severe disease include those that are less than 6 months, premature infants, children that have underlying cardiac, lung, or neuromuscular disease, children that may have some form of immunocompromise, and lastly, children with cystic fibrosis. When it comes to adults, those that are greatest risk are those that are greater than 75 years of age, and those that have significant underlying diseases, such as heart and lung disease, or maybe immunocompromised.
Why does it seem to skip between young people and older people? Why is it missing that middle part?
So RSV does not miss the middle part. During our later childhood and adult life, we intermittently get infected with RSV. However, severe manifestations of the infection are much, much less.
What are the symptoms?
RSV is similar to influenza and COVID and other respiratory viruses. And it could really present in sort of 3 different forms. Some individuals may just have a mild upper respiratory tract infection, such as sore throat, runny nose, a little bit of a cough perhaps. And in some individuals, as more severe disease develops, such as lower respiratory tract disease, they could develop shortness of breath. Sometimes children develop wheezing. And with all of these manifestations, and particularly with severe disease, fever, decreased energy, decreased appetite, and in young children sort of being listless are the sorts of symptoms that may occur.
So how does RSV spread between people?
Similar to influenza and COVID, it spreads through respiratory droplets primarily. These could be large droplets that the risk is greatest when you're in close contact with someone, generally less than 6 feet. But it could also spread at greater distances as the virus aerosolizes into small particles and the individual breathes those in. Less commonly, you could get infected if you kiss a individual that's infected, such as perhaps a grandparent kissing an infected child, or less commonly, if the virus lands on an inanimate surface, you touch that surface and subsequently touch your eyes, nose, mouth, you go ahead and infect yourself in that manner.
Now, maybe it's just me, but is RSV something new? I just don't recall hearing the term in the last couple of years, if ever, really.
So RSV is not new, but it's one of those viruses that's been somewhat under the radar screen. Pediatricians are quite aware of it, of course, because all children get infected before the age of 2. And it results in a significant number of hospitalizations and emergency room visits and office visits as well. Estimated 2 million office visits a year for RSV.
Wow.
But I think we've had greater awareness in the last few years that older adults, particularly if you're frail with underlying diseases that's discussed, are at risk for developing serious infection, which could be lethal.
Now, I understand the FDA recently approved a new vaccine for certain age groups. Can you tell us about the vaccine?
I can. And this is going to be a little complicated, so let's break it down into 3 parts. First, let's start with adults. 2 vaccines have been approved by the FDA, both against RSV, one by Pfizer and one by GSK. It's been approved for adults of the age 60 and older, with the caveat that individuals should receive this vaccine in discussion with their healthcare provider to assess relative risk benefits. I strongly recommend that individuals that are 75 and older, or those individuals 60 to 74 with significant underlying disease or immunocompromised in some fashion, strongly consider receiving this vaccine. That group is at greatest risk, as we discussed, for landing in hospital and having a bad outcome. If you're in the 60 to 74 group and otherwise healthy, I think it's best to have a discussion with your healthcare provider whether the RSV vaccine is right for you or not this season.
So with the RSV vaccine, we have that, we have the flu vaccine, we have the COVID vaccine. Would you recommend for maybe someone of my age, 61, or maybe for someone who's younger, to get all 3? And I would assume you can't get them all at the same time.
Well, let's hold off on that 1 second, John. And do you want to talk about the other indications for RSV vaccine, which are quite important?
Sure, absolutely.
The next group that had the FDA's approved an RSV vaccine for are pregnant women. And this vaccine has been recommended for pregnant women that are at 32 to 36 weeks of gestation. And the concept between vaccinating this group is not so much to protect these pregnant women from RSV disease, but to protect their yet unborn child. As we mentioned, children that are in that 0 to 6 months age group are at high risk for developing RSV disease. If a woman gets vaccinated at this stage in her pregnancy, the antibodies that will develop over the next 2 weeks will transfer across the placenta and will serve to protect their child when born for up to 6 months, that critical period when they're at risk for more serious disease. The protection is greatest in the first 3 months. It wanes a little bit over time, but it's shown to significantly decrease the likelihood if the pregnant mom is vaccinated in this time frame that their children will develop severe disease and land in hospital and have a bad outcome.
Sure. What would be the downside of a pregnant woman not getting the RSV vaccine? And how long would the baby be protected from getting a serious case of RSV if the mom does get a vaccine?
So if the mom gets the vaccine, the protection is reasonable for those first 6 months of life, which is the critical time frame. The safety profile of this vaccine looks very good at this time. And so there's not really a major downside. The vaccine's been approved because the benefits are felt to outweigh the risks. Certainly, we appreciate that pregnant moms are very nervous sometimes about getting vaccinated. But keep in mind, this is all about protecting their baby, which is always what moms have first and foremost in their minds. However, if the pregnant mom chooses not to get vaccinated, there is an alternative. This alternative is a monoclonal antibody that's long-acting and really lasts up to 6 months. Unfortunately, this monoclonal antibody that goes by the trade name Beyfortus is in limited supply. However, if you want to protect your newborn child and they fall in a high-risk group, then the FDA has approved this monoclonal antibody as a different form of protection for our young children. So in short, those are the 3 tools now that we have for RSV vaccine that have developed this year. The vaccine for older adults, the vaccine for pregnant women, and the long-acting monoclonal antibody to protect our high-risk children.
So if an infant gets RSV, why does it become so serious in infancy? And what can be given to the infant who has RSV? And my God, I hope it's not fatal. Tell us about that dynamic.
So as we already mentioned, there is a bad RSV season. There could be as many as 300 deaths in this country a year. The vaccine for pregnant women, the development of this monoclonal antibody treatment are new and important tools to try to minimize the adverse outcomes that could result from RSV infection. Now, as I said before, all children by the age of 2 will get RSV infection. However, we've identified those high-risk groups, and those are the ones that we would like to protect the most at this time. However, even for individuals that are less likely to have a severe disease, by RSV vaccination in pregnant women, the hope is we could significantly decrease the number of office visits, which, as we mentioned, could be as many as 2 million. Emergency department visits, which are in the order of tens of thousands, and of course, those bad outcomes as already mentioned.
Those are some significant numbers. We're talking with Dr. Thomas Russo, and expert in all of this, and we're talking about specifically RSV. So, Doc, if I'm a parent and my child comes out with what we think is RSV, how do you know it's RSV or just a cold or a severe cold? Are there some distinctions that you would take a look at?
That's a problem at this time because RSV could look very much like influenza, COVID, or other respiratory viruses. The only way to be absolutely sure is to perform a test. And there's molecular tests that are very sensitive and accurate that are available in our emergency departments and other healthcare facilities. However, if there's someone in the household where viruses we know spread particularly well, it's been documented to have RSV infection, and another individual then develops respiratory tract infection symptoms, it's likely that they have that virus, in this case RSV, if someone tested positive.
So how can people who aren't eligible for a vaccine protect themselves from getting RSV? Or if they get RSV, would then they become eligible to get the vaccine to get rid of it?
So if you develop RSV, treatment at this time is primarily supportive. And that includes oxygen support if necessary, and more significant measures such if need be, using ventilation, etc., for children. There's also medications that we could do to minimize wheezing and obviously control fever and other symptoms as well. So the secret with RSV is try to prevent infection, particularly in that high-risk cohort where we know runs the highest likelihood of landing in hospital and having a bad outcome.
So let's go back, Doc, to what we jumped to ahead just a little bit ago about the flu shot, because you have the flu shot, RSV shot, COVID shot, and I would think that they all have to be happening separately, not at the same time. And what is the time frame for people who would need all of them or some of them?
Well, I think we'll get to eventually discussing who would be most appropriate to get these particular vaccinations. We already talked about RSV in both pregnant women and older adults, 60 and older. For both influenza and COVID, both these vaccines have been approved for all individuals 6 months and older. And although there's no group that's at zero risk for having a severe outcome from these two viral infections, the highest risk group are similar to those that we discussed for RSV. Our older seniors, particularly if you're 75 and up, and those with significant underlying disease. I strongly recommend getting these vaccines in all age groups. It's impossible to predict who may develop more severe disease. And not only do these vaccines decrease the likelihood that you'll develop severe disease, but they'll also decrease the likelihood that you'll become infected, you'll have a shorter infectious period, and be less likely to transmit the virus to others. And that could be very critical when you interact with older individuals that are more susceptible to severe disease. So once you decide which vaccines you're going to receive and are appropriate, and this may be best done with your healthcare provider, the CDC recommends you could get all three vaccines at the same time. We do have data that shows that you can safely get RSV and the influenza vaccine at the same time, and that you could get the influenza and COVID vaccine at the same time. We do not have data at this time that you can receive all three vaccines safely, albeit the CDC feels comfortable in recommending this. I think the key point here is this. If you only have one opportunity to get vaccinated, based on your job, your location that you have to travel, it's best to receive whatever vaccines you decide upon that visit. However, if you have the luxury of time and you could get different vaccines at different time intervals, I favor separating them by 1 or 2 weeks. And the reason I say so, and this is particularly true for people that have reactogenic symptoms, such as when you get your flu or COVID vaccine, you may have flu-like symptoms for a day or so. If you get multiple vaccines at the same time, it's possible that those reactogenic symptoms could be exacerbated. And therefore, if convenient for you, let's spread them out over time. However, I think it's critical that if you only have one chance to get the vaccines, please do so, because we don't want to miss an opportunity for an individual to get this important protection.
And talk to us, Doc, about the updated COVID-19 vaccine and how that's different from the bivalent vaccine, and why some people are not getting the vaccine.
I think everyone appreciates with influenza that each year we update the formulation of the vaccine to best match what of the influenza viruses we think may be circulating in our community. That is what we've done this year, COVID. The updated COVID vaccine is based on an Omicron variant, XBB 1.5, and albeit that variant now is not circulating at high levels, most of the variants that are circulating in this country are closely related, and the vaccine is predicted to be highly efficacious, particularly in preventing severe disease, hospitalizations, and bad outcomes. And I think there's a variety of reasons for this. And most people out there are saying, hey, I've had COVID. I've had previous vaccines. I'm good. COVID's gone in the rearview mirror. I haven't heard much about it in the media lately. And so no reason to go ahead and get another vaccine because I don't need it. Unfortunately, this is not the correct approach. COVID is still with us. And I anticipate that over the subsequent months, that are cooler, we're indoors where the virus spreads more readily, and we celebrate Thanksgiving and the religious holidays with gatherings of individuals that will have an increasing number of cases and unfortunately increasing number of hospitalizations and bad outcomes. Now, reason that we're not done with COVID and people mistakenly feel that they're good if they were previously infected and or vaccinated is that protection wanes over time, similar to our protection with influenza and RSV. And the virus continues to evolve. And so the forms of the virus that are circulating now are more immune evasive, and the wall of immunity that we've built up is quite imperfect. This new updated formulation will help us rebuild that wall, and it's an important tool to minimize the severe consequences of acute COVID infection. I think it's also important to note that the new vaccine will also decrease the likelihood that one develops long COVID, which is obviously an important consequence of infection as well that we're really not talking enough about.
I know UB has been studying the effects of long COVID. I remember we talked about that in one of our previous programs.
Yes, UB has opened up a long COVID clinic. There's a huge need for that. Right now, we're still in the early days of defining long COVID, developing diagnostic tests and efficacious treatments. But it's a good start. But the best way to manage long COVID is never to develop long COVID. And getting your updated COVID vaccine is one of the most important means to go ahead and do so.
We're talking with Dr. Thomas Russo. We have about 5 minutes left in our program. Dr. Russo, we want to get to a couple more points. People seem to have an appetite, well, they used to have an appetite for wearing masks. Now, not so much. But you mentioned with the winter season coming up and people being indoors and for gatherings, should we go back to being proactive and wearing masks?
Well, let's be clear. Masks work. When everyone was using masks, influenza almost disappeared. We had no other respiratory viral infections. And though COVID still plodded on, it's one of the most effective non-vaccine drug-based measures in terms of managing infection. Right now, we don't see many people wearing masks. So people feel a little uncomfortable wearing masks in public settings. However, I recommend mask use under two circumstances. First, if you have any sort of respiratory symptoms, whether it be COVID or some other unknown respiratory virus, and then you're going to go out and interact with individuals, it's considerate to go ahead and wear a mask so that you protect them. Obviously, it would be best to stay home and follow isolation guidelines, but we know that's not always possible. So mask use in that setting would be extraordinarily important, to minimize the spread of infection. Those individuals that are immunocompromised, are our most elderly, frail seniors, have significant underlying diseases of whatever age, when you go to higher risk settings, indoors with poor ventilation where other people are not wearing masks, if you cannot avoid that scenario, that may be a situation that you want to strongly consider wearing a mask to protect yourself.
We have a lot of masks here at the station. I know a lot of people still have boxes of them, and not a bad habit to get into. Where can people get some trusted information to protect themselves from getting sick or worse?
Yeah, there's multiple reliable sources. There's one other thing, John, I want to touch upon before we go into good sources for information. And besides getting the updated COVID vaccine, we have very efficacious antiviral therapy that's available at this time that will increase the likelihood that you develop severe disease and land in hospital. And that would be Paxlovid or molnupiravir. And the secret is to start these medications as soon as possible. And if you're at high risk for developing severe disease, it's particularly important because that'll afford the greatest protection in that high risk group. But it will also increase the likelihood that you develop long COVID. So the secret is to have those home tests readily available, get them free from the government. As soon as you develop any respiratory symptoms, as minor as they may be, go ahead and test. And if you're positive, reach out to your healthcare provider to see if you're a good candidate to receive one of these potentially life-saving medications. You know, we have the tools to minimize the consequences of influenza and COVID, and we're just not taking advantage of them. Now, with regard to reliable sources, the CDC is obviously a great site. There has been some individuals, however, that have mistrust in government that may not feel comfortable using that site. Alternative site would be academic universities. For example, Johns Hopkins also has a great site with information about COVID and other respiratory viruses.
Well, Dr. Russo, we thank you for joining us. SUNY Distinguished Professor and Chief of Infectious Disease in the Department of Medicine at the Jacobs School of Medicine and Biomedical Sciences. We hope to see you again and get us an update on everything. And thank you for the work that you do, not only for Western New York, but for the world.
Well, my pleasure to be here. And I hope this information is helpful to our viewers out there.
It certainly has. Thank you, Doc. Dr. Russo sure had some good information. And for more, you can go to the website for Buffalo Healthy Living magazine. You can find the article about Dr. Russo and a website that has other information. Now, the website for Buffalo Healthy Living magazine is buffalohealthyliving.com. And for the vaccine finder, you can go to this website, vaccines.gov. Thanks for watching. Be safe this season and be well. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living magazine and its sponsors.